So in this video, we're going to be talking about two very important muscles, the Fibularis longus and the Posterior Tibialis. Now these two muscles run down the lower leg and wrap around these two round bones called the medial malleolus and lateral malleolus, right? Now what's very interesting about those two muscles is that they come around and actually sneak under and attach at the bottom of the foot. And so their role is to facilitate plantar flexion combined with inversion and plantar flexion combined with eversion. So the inversion is going to be the posterior tibialis, and the plantar flexion and eversion is going to be the fibularis longus. Now the reason we want to facilitate or learn how to isolate these muscles is because of the anatomy of the actual ankle joint. So the talus, it's the bone that kind of sits in between these two round bones. It's more narrow in the back. So what that means that when you go into plantar flexion, the two malleoli actually come closer in together and go in towards that narrowing of the talus, which means that there's less bony support in this plantar flex position. That's why plantar flexion and inversion sprains are so common. Eversion sprains not so much, but when you go into dorsiflexion, because the talus is wider in the front part, and when it translates back or slides back, it actually is going to have more bony support. So you're very less likely to have a dorsiflexion sprain, or if you do, it requires way more force, which is why it tends to be a little bit more traumatic. So understanding that, we can start to train the muscles that are responsible for stabilizing our ankle joint in this plantar flex position in both inversion and eversion. Now what I like to do is I like to grab a sock and find a slippery surface, kind of like wood floors or tile or whatever works for you at your home. And I like to use it in order to be able to freely manipulate my position of my foot and kind of slide it in and out. The reason is I'm going to want to very deliberately and actively control the positions, because we're going to try and isolate those muscles by doing that. So in order to first work the posterior tibialis, which is going to help us with plantar flexion and inversion, we're going to start by getting in this modified combat base position. So I'm working my right ankle. My right ankle is in front of me. My left ankle is under this knee. So I'm kind of in this seated position. And I'm going to get close to this ankle. And the reason is I want to start in knee flexion. If I'm in more knee flexion, I can freely adduct the foot and kind of put myself in position. So I'm going to adduct the foot. I'm going to try and focus on pressing the outside of my foot down into the floor. That's going to facilitate inversion as I go into this plantar flexion. So what I'm going to do here is I'm maximally adducted, and I'm going to start to slide my foot out. So as I slide my foot out, I'm trying to really rotate and adduct even more, and then I'm also trying to press the outside of my foot down. So you'll notice as I do that and I slide my foot out, I'm going into more plantar flexion and inversion. And I really feel a strong contraction on the inside of my shin, and also a very strong stretch on the outside of my ankle. Now, as I bring this back in, I'm going to facilitate and continue to adduct and press the outside of my foot down. And that's what's going to allow me to maintain a strong contraction in that posterior tibialis. You might even get some action in the knee joint, because that when you adduct the foot, you're also internally rotating the knee joint. So you might even feel some of that popliteus, or kind of like this sensation of contraction in the knee joint that you can't really pinpoint. That's most likely your popliteus muscle. Now, when we want to work the fibularis longus, we're going to do the opposite. So instead of adducting the foot in this knee flex position, we're going to abduct the foot. Now the fibularis longus is going to facilitate plantar flexion and eversion. So I'm going to turn my foot out, and instead of pressing the outside of my foot down on the ground, I'm going to try and press the inside of my foot down, because that's what's going to facilitate the eversion as I slide out into plantar flexion. So from here, I'm going to start to slide my foot out, and as I do that, I'm trying to press and collapse my arch like I'm trying to pronate. And I'm really trying to also abduct the foot and turn it out. And I should really feel a strong contraction. I'll kind of turn around so you can kind of see. You can see the contraction of this lateral compartment here. And I'm really trying to collapse and make contact with that first MTP joint on the ground. And as I come back, I'm going to try and collapse even harder in order to really work that eversion. Now, the main focus of this is to work that plantar flex position and eversion, so you can stay out here and focus on isometrically contracting, everting even harder, and your goal is to feel that contraction of line of tension really isolate here on the outside. So similar to how when we went into plantar flexion and inversion, we worked knee internal rotation. When we work this plantar flexion and abduction and eversion, we'll also get some knee external rotation. So don't be surprised if you feel some of that biceps femoris contract. That's the muscle that attaches here onto that fibular head. And so when we abduct the foot, you'll notice that's the muscle that helps you do that. So you'll notice a lot of tension kind of running out through this lateral seam. So just be aware of that and kind of be conscious of it, because you can actually start to deliberately train this motion, and that's going to really help you isolate and create tension and stability on both sides of that lower leg. So give that a shot and let me know what you think.